Hi there, my name's Karen Holt, student number 252159. This is assignment 4 for Foundations of Critical Inquiry. The topic I'm going to discuss today is whether curcumin is effective in the treatment of inflammation. So first, I think I'll tell you what curcumin is. Curcumin is obtained from the turmeric rhizome. It's actually called Curcuma longa. And the rhizome grows under the ground. People dig it up, they grind it up, and from that they obtain curcumin. It's long been used by Ayurvedic medicine and Chinese medicine to treat many and varied conditions, mainly digestive disorders. The other thing I think we need to define is what inflammation is. Inflammation is the body's response to an invasion by a foreign body or to injury. It usually can result in soreness, pain, redness, swelling, and in worst case scenario, loss of function. The types of inflammation I had in my mind when I did this study were things like arthritis, irritable bowel syndrome, fibromyalgia, things like that. So the 5 studies I did, of them 4 were really quite positive, 1 not so much, and that's the one I'll talk about first. So the first one was on 42 men and women with elevated total cholesterol levels. There was a 6-week trial, and half the people were given curcumin, half were given a placebo. At the end of the trial, they found there was no reduction in any inflammation markers and there was no reduction in cholesterol levels. However, encouragingly, they did find that although the people who undertook the trial had raised curcuminoid levels in their blood, it was not having an adverse effect. So the people who did the study said that curcumin was safe, if not effective, in their trial. They did suggest, however, that perhaps they should have started on people with more inflammation than what they had. The next study was done on 47 male elite cyclists. All of the cyclists were put on a Mediterranean diet. Half were given curcumin and boswellia. Half were given a placebo. Now, the only trouble with this trial I found was the mixing of the curcumin with the boswellia. Boswellia itself is an anti-inflammatory, so it was hard to know what was having the effect. Was it the curcumin, was it the boswellia, or was it the two mixed together? However, at the end of the trial, it was found that it was an effective anti-inflammatory for people who'd undergone prolonged and strenuous exercise, which is an encouraging result. The next trial was done on 18 healthy males. 9 were given a placebo, 9 were given curcumin. What they were measuring was the hepcidin levels. Hepcidin is produced by the body before inflammation comes along, and this study found that the hepcidin levels were decreased significantly. However, this was a very, very short study. It was 24 hours. It was a pilot study, and it was done on quite a limited population. The next one was done on 16 patients with stage 2 and stage 3 chronic kidney disease. Half were given a placebo, half were given curcumin and boswellia. It was found that the curcumin boswellia had a significant effect on prostaglandin E, which is very encouraging. However, once again, we've got a very specific population group of really ill people. So that's a hard test, I think, to reproduce with any accuracy. However, it was a positive result. The last and most positive result was done on 90 patients who unfortunately had their third impacted molars removed in a dental surgery procedure. Half the people were given curcumin, half were given a non-steroidal anti-inflammatory drug. All of them experienced less post-operative pain, obviously being given a painkiller, but the people who were given curcumin had significantly less pain than those given the non-steroidal anti-inflammatory drugs. So that, I think, is a really, really good trial. A lot of people and quite a positive result. The big fallback there is that it's a very, very specific condition again. However, of my 5 trials that I chose to research, 4 were really, really encouraging, I think, and 1 was maybe not so encouraging, but it did state that curcumin was a safe product. So that's good to know, considering how widely it's available today and the promises that are made on packets in both chemists, supermarkets, health food stores. It can cure anything from a sore toe to a headache, I think, if you listen to the spiel. So in answer to my question, is curcumin effective in the treatment of inflammation? I believe it is, yes. But I do believe a lot more needs to be done in order to pin down the right way to have it administered, to increase its bioavailability, and also to nail down the most optimal dose. Thank you for watching my presentation. Have a great day. Thank you.